of April to highlight the collective action needed and to promote the use of vaccines to protect people of all ages against disease. The theme for this year's celebration is the Big Catch-up. The World Health Organization is working with partners to support countries across the globe to raise awareness of the value of vaccines and immunization to get back on track to ensure more people are protected from preventable diseases. The ultimate goal of World Immunization Week is for more children and adults and the communities to be protected from vaccine-preventable diseases, allowing them to live happier, healthier lives. Well, joining us live now is Health Manager, UNICEF Nigeria, Dorothy Ochola-Idongo. Thanks for joining us on TVC News at 7. It does appear that since COVID, the world just doesn't seem to be the same, and particularly with regard to immunization. Talk to us about the Big Catch-up.
Yeah, good evening, and thanks for having me with you. Indeed, the Big Catch-up is very necessary. UNICEF has just released the State of the World's Children report, which does a lot of analysis to look at what has happened with childhood immunization since the COVID pandemic hit in 2019. And basically what it's showing us is that there has been a huge number of children that have missed out on immunization as a result of the COVID pandemic. Roughly 67 million children have missed out on one or more vaccines. And quite a number of those children are in countries like India and Nigeria, Nigeria being the second largest with 2.2 million children missing out on the vaccines. Part of the reasons for this, apart from the COVID pandemic, is that we also have weak health systems. And during the COVID pandemic, we had a diversion of resources that are quite scarce. That is the health workers, the supplies and equipment, and so on. And then there's also the issue of demand and ensuring that we continue to sustain the confidence in vaccines. So these are some of the issues that led to the backsliding of vaccination coverage in the last 3 years from 2019 to 2023.
Indeed. And just as you have alluded, Nigeria is one of the 20 countries that have 3/4 of the children missed vaccinations in 2021. Now, how is UNICEF Nigeria partnering the Nigerian government for the Big Catch-up? If you can hear me, Mrs. Idongo, yes. I'm asking how UNICEF Nigeria is partnering the government of the country to actually achieve the Big Catch-up.
Yeah, thank you very much. Indeed, UNICEF is partnering with the government of Nigeria in a number of ways. First and foremost, we have to ensure we are supporting them to map out where these missed children are. And what has happened is that we under the leadership of the National Development Health Care Agency, 100 LGAs have been mapped out in 18 states. And these are the LGAs that have the most children that are missing out on vaccination, and UNICEF will work with government to conduct outreaches to strengthen the immunization system in order to reach these children. That is one. Secondly, we're also working on demand generation activities to ensure that we continue to boost the confidence in vaccination, and people do not forget the importance of vaccination. With that, we are using all sorts of media. We support a network of voluntary community mobilizers. We work with religious leaders, traditional leaders who are the gatekeepers of society, and we also work with the media to ensure that the right information gets out there, that we need to push for this big catch-up.
And then we can go on and on. Ms. Idongo, we can go on and on about this. Yes. But then, considering that today is World Malaria Day, I'm curious as to your level of optimism about malaria vaccines.
Yes, Nigeria has plans to introduce the malaria vaccine, but not this year. That is next year. And the plan is that if all approvals get through, the vaccine will be introduced from around March of 2024. And it will be introduced in 4 phases, because we also have to keep in mind the availability of these vaccines globally. So we trust that in those 4 phases, we should be able to slowly introduce the vaccine and reach the children that need it. It's mainly going to target children, and it's given in 4 doses, from 5 months to 6 months, and then 18 months. So we have that optimism that Nigeria will succeed in introducing this vaccine, but sometime next year.
It's been great speaking with you, Health Manager, UNICEF Nigeria, Dorothy Ochola-Idongo. Thank you very much for talking to us.
Thank you very much.